Some of the most important things to kind of maintain your joints throughout your life. It really starts early on when we aren't thinking a lot about it. So it's really just having an active lifestyle. Being active on your joints is actually very important. You want to really maintain a good exercise habits, maintain healthy eating habits, maintain a good weight. All these things really have an effect on your joint as you move through life. Further down the road, fortunately, we all get wear and tear, just kind of the nature of living. But old injuries can affect your joints going down the road as well. So these are things that may have happened when you were younger. That can really affect you 20, 30, 40 years down the road. And that may be a cause for problems later in life. Well, yes, it's better to be more active. When you're inactive and sedentary, your muscles are weaker, you're not stressing your joints and your bones appropriately. Your body really reacts to stress. And good stress. Stress is not a bad thing all the time. The musculature around your joints, whether it be hips, knees, shoulders, what have you, really benefits from strong musculature. If your muscles surrounding the joints are well conditioned, well toned, it really offloads the stress going through the joint. When you're sedentary, overweight, those sorts of things, it really putting a lot of stress on that cartilage through the joint and everything like that. So that's why it's good to have that nice strong musculature around any joint. So something to keep in mind for seniors is, it may not be too late. It kind of depends on where we're at when we kind of meet. Sometimes the disease has progressed to a point where maybe some of the exercises and things aren't going to be as beneficial as what they would have been. But that's not to say that we don't try. A lot of times when we first see somebody in the office, we'll evaluate them with x-ray and kind of go through the exam. But you do like to start with a little physical therapy, and we really encourage people to really try to get out there and do as much activity as they can tolerate. Now that's not always possible. Sometimes it really hurts too much, and that's when we talk about other options for treatment and other options really to kind of make things as comfortable as possible. Ultimately, sometimes a joint replacement is the thing to move forward to, and that's something that we definitely have that discussion with as we kind of move through the treatment process. In joint replacement and orthopedics in general, we really are looking to get people back to the activities that they enjoy. And this is what we really strive for.